Now the next speaker is Dr. Ajay Agarwal when the glaucoma patients would require low vision aid.
A very good morning to all of you, and I would like to take this opportunity to thank the AIOCMT executives for giving me this opportunity to present this on today. So I'll be talking about when will the glaucoma patients require low vision aids, no financial or proprietary interest. So we all know that glaucoma is a group of disorders in which there is progressive optic neuropathy and there are corresponding visual field defects. And consequently the patient has problems with the visual fields as well as the decreased vision in the advanced cases. So we all know that the management is therapeutic and surgical, but the visual rehabilitation part is something which we focus less on. So this is needed for all patients who have advanced glaucoma with low vision, both children and adults. So it is a misconception that only the elderly require low vision aids. Congenital glaucoma patients also will need the low vision aids. So the approach to the management includes after surgery, you can see the visual rehabilitation is extremely important in all patients with congenital glaucoma. So the definitions for low vision have already been discussed. So anything less than 6 by 18 to 3 by 60 and a field of vision around 10 degrees. So low vision is a functional visual impairment which is not correctable by standard glasses, contact lenses, medicine or surgery, which interferes with a person's ability to perform his day-to-day activities. So there are a number of things which are important when we live with glaucoma, and the disorder is basically the anatomical change, impairment is the functional loss out of that visual disorder. Disability is related to the skills and ability of the individual, and the handicap is the psychological and economic consequences of such a visual loss. So all of these have a great impact on the person with low vision. So if you see the main causes of low vision in children and the elderly, so both spectrums of the age group in glaucoma patients will require low vision aids. So there could be either a peripheral field loss. In certain glaucoma patients, the central field loss also kicks in very early, and there is overall blurring of the vision. So what are low vision aids? Put simply, they are devices which help you to see better. So these can be optical or non-optical devices. Essentially, they could be optical, non-optical, electronic and complex devices. So these are of 4 types. Among the optical devices for distance vision, we have the telescopes as well as various electronic systems. For near vision, there are magnifiers and other electronic devices. And then there are the non-optical devices which reduce the glare, which enhance the contrast. And then there are newer computer softwares also which are useful. So coming to the distance optical devices, these include the various types of telescopes which are there. So telescopes essentially work on the principle of angular magnification which is up to 10 times, and they can be given for near, intermediate as well as for distance tasks. However, one thing to remember is as you magnify things, the field of view is going to decrease. Then you have the bioptic telescopes, which are essentially combining the conventional eyeglasses and the telescope in front of them. So you can either look through the bioptic lens system or through the telescopic portion when you want to look at a distance. Then there are various handheld telescopes, and these have a magnification up to 10 times. So that magnification part is limited here. For near, there are various types of magnifiers, and one of them is the spectacle magnifier, which is a spectacle mounted convex lens which uses the principle of relative distance magnification. It has the disadvantage of reduced illumination and short working distance, But this is one which is psychologically acceptable to many people and has a fair field of view. These stand magnifiers, which you can just keep on the reading material, and these could be illuminated or non-illuminated. So these are there. And then you have handheld magnifiers, which are essentially convex lenses with a handle, and these again may be self-illuminated. And most of these magnifiers are actually very portable. Then you have dome magnifiers. There are these Fresnel sheet magnifiers and the pocket magnifiers, depending on the need of the particular patient. Then you have various assistive devices, including the CCTVs and the portable video magnifiers. So the CCTV consists of a monitor, a camera, and a platform to place the reading text. So you can see the book is placed down, and the thing is magnified on the screen, which can be seen by the person. You can also control the brightness and the contrast. So you can magnify things as much as 60 times. So that is the advantage. But of course you need to keep it somewhere. That is the disadvantage. Then you have the mouse model CCTVs and the desktop CCTVs, which may be useful for the elderly population. Then non-optical devices, there are a number of categories of these non-optical devices as well. One is the writing guide, where the patient can feel the empty cutout spaces and write on those spaces. There are glare reducing devices like sunglasses, Polaroid glasses, and Noir glasses. There are the Corning photochromic glasses, where contrast can be enhanced, and essentially there are yellow and amber filters here. So these attenuate 100% of the UVB wavelengths and also the blue light, which is responsible for a lot of scattering and discomfort to the patient. Out of these, the CPF 511 is useful for the glaucoma patients. There are Noir filters which absorb the scattered light, so that is one. So for patients who have early and moderate glaucoma, the CCTVs, the Corning glasses, reverse telescopes, prism systems are extremely useful. Then because the field of vision is affected, there are visual field enhancement devices which compress the images. These provide prisms which relocate the image. And then there are field expanders of various types. So like the Fresnel prisms, reverse telescopes, and the field expanders. Newer technology includes the Kindle or the iPads, the implantable telescopes, the Argus retinal prosthesis. Again, these are very expensive as of now. And for end-stage glaucoma, you have the canes or the sighted guides. So glaucoma is a group of disorders in which there can be significant progressive optic neuropathy. Patients with advanced glaucoma need low vision aids. So visual rehabilitation and counseling of the patients is as important as IOP control. And we need to customize these LVAs because one size does not fit all. And thank you for a patient hearing.
Thank you, Dr. Ajay, for excellent presentation on low vision aids in glaucoma patients. Again, glaucoma is very common, so we are highly benefited with your talks.